Well, we've got lots of people who want to ask you questions. I'm going to bring in Dean Russell next. Dean.
Thank you, Chair. I'll direct my first question is actually to Shanti and Tim, if I may. About 10 years ago, I actually set up the Health and Wellbeing Partnership in St Albans as part of the District Council. And one of the first projects I was involved in was a review of all the schools by the St Albans Youth Council to ask them about mental health provision. And so it's great to hear what you're doing. And one of the things that came through in that report, if I recall correctly, was that some schools had provisions, some others didn't, but some of them that did have provisions, actually the pupils didn't know where to go to because it wasn't permeated throughout the school. So some teachers knew it was available, some didn't. And I was just interested from your perspective and your experience, how do you make sure that you do have a whole school approach to make sure all the teachers know where to point the pupils, but also so that pupils know where to go? If I go to Tim first, if I may.
I think hopefully to answer your question, no doubt Shanti will expand. The most positive thing, now we have a single form entry primary school with a specialist space, so we're not a large school. I've got a staff of about 35 with some part-timers. But I think the most positive thing of this for me is the culture in the school over the last couple of years since we became involved in this pilot has changed. We have adopted that whole school approach to talk positively about children's emotional and mental health and well-being, and also staff. And for me as a head teacher, that is crucial. Although this was, I think, set up primarily to support the children, the culture in the school is that it is now, it's not just acceptable, it's a really positive, healthy thing to be talking about ways of looking after yourself, your emotional and your mental well-being. I think we've still got, as on the example I gave earlier, one or two parents who don't quite see it like that, but for the children, it's completely natural. They could list you off the 5 ways for well-being, the activities they do, both at lockdown and at school to support that. And I think everyone knows now, if there is a concern about a child, the dialogue, the communication is very open. They would come to speak to either Shanti or myself, and then we put them towards our health workers. So it isn't that some people have knowledge, some people don't. I think for me as head, the biggest, most positive effect of this is that it's raised the profile in a very positive way, hopefully in a way that will support these children when they leave us through adolescence into teenage years and beyond. We're laying the foundations here now that with all the pressures that are going to lie ahead, hopefully for many will stand them in good stead.
Fantastic. And if I may, Shanti, ask you the same question, but could you share any things that you've done that perhaps you would have done differently, or perhaps areas that were problematic? I know engaging with parents in some cases was one of those examples.
I suppose with parents, at the moment we've been explaining all the things that we're doing. It's just making the parents aware of the different opportunities that we have on offer. And I think the children are very keen to talk about their mental health. They're very, as Tim said, they're very aware of their 5 ways to well-being. I think it boils down to the stigma attached to mental health, and parents perhaps being very concerned that their child might be labelled, or that it might have an effect on their child going forwards if they've been identified for any particular anxiety or any other mental health concerns. I think that's where the biggest hurdle lies with the parents. Or on the other side of that, there's the parents who are very quick to say that a child is suffering from anxiety or suffering from something a little bit more problematic with their mental health, rather than looking at ways to support that emotional regulation and recognizing emotions for the sake of emotions. So we've got sort of the 2 extremes there.
Yeah, thank you. And if I may just ask Dr. Alicia, if that's okay, just from your experience, what encourages schools to get involved in this sort of program? Because I can imagine for some schools, if it's more highlighted that there are children with mental well-being issues, as it were, or there are issues there that might put them off because of the stigma. I'm just interested in how you break down those barriers to get that first level of engagement.
Sure. So I think from what we're hearing from schools, mental health is a priority. It's up there as one of the top priorities for schools. But what we're hearing is that schools actually need more time, and I think Shanti has said that time is a big issue. It's a big barrier to supporting mental health and well-being. Other barriers around flexibility, being able to support the implementation and integration of interventions and support within the curriculum, but also within everyday contexts and interactions with young people. So I think, again, the adoption of a whole school approach, it can take the pressure away from needing to find just curriculum time to implement these interventions. And, exactly as Tim was saying, it's hugely important that we operate at the ethos and environment level of the schools so that we're supporting young people's mental health and well-being through non-curricular ways. And when we're operating at the ethos and environment level, we need to ensure that all staff are trained in mental health so that their everyday interactions with young people are supporting young people's mental health and well-being. And it's not just left up to, a 10-week curriculum, 10-week program. It's much more about our everyday interactions, how we're responding to young people in the corridors, outside of classroom, how they're responding with each other. So really important. And the third part of the whole school approach, I think also getting at what Tim and Shanti have been saying is that engagement with parents, so that the work that we do in schools is really being supported and reinforced in the home environment. And I think, a way of addressing the stigma around mental health is the need for universal provision. These aren't skills that are just for those in particular need of mental health support, but actually they're of universal relevance.
Thank you. Thank you very much. Back to you, Chair.
Thank you very much, Rosie.